Hello, everyone. I'm Joan Dixon, Director of Student Programs at Gulf Coast South Area Health Education Center. We are here today for our Career Chats video with a registered nurse who specializes in home health nursing. But first, I want to remind you of the 6 REACH student programs that we offer. All of these programs are free of charge. You can watch the Health Careers presentation on our website. You can see our full Career Chats video library on our website. You can attend our Health Careers summer camps. If you're in a HOSA club, reach out to me. I can come out and help your club prepare for the competitive events at the regional, state, and international competitions. If you're in high school and you're really interested in public health, you can join my public health internship program. Then once you get into college, into a graduate level program, you can become a part of my AHEC Scholars Program. All of them free of charge to students. Notice at the bottom of the screen, it has my name, my email address, and my phone number. Please feel free to contact me anytime you have any questions about our REACH student programs. I am so excited to have with me today Lisa Endick, who is a registered nurse specializing in home health nursing, who also works within care coordination and community outreach as a certified dementia practitioner. For those students who may be a little unsure about home health nursing and exactly what that means, a home health nurse or a home health registered nurse is responsible for traveling to a patient's home to administer their services and helping patients maintain their independence. Their duties may include administering at-home IVs, changing dressings, cleaning wounds, and updating their physicians about their patient's health. Lisa, welcome today to our career chat.
So happy to be here. It's a
Well, we're
career
happy to
that
have you.
I'm so passionate about, and honestly, I wish that every teenager would give it a thought because nursing has been amazing.
That is wonderful. And I have interviewed many nurses and nursing specialties for my career chats videos. And you've got to be in nursing for the love of the job, the love of your patients, taking care of people. And it really shows in what you do. So my hat's off to you, Lisa. Thank you.
Thank you.
Can you give us a little overview of the job description? We're going to start out in home health nursing, and then we're going to follow your career journey to where you are today. When you were first starting out in nursing, tell me what made you choose home health nursing over all the other specialties you could choose from?
I really liked the thought of education because really the part when you were describing a home health nurse, in my opinion, the biggest thing that a home health nurse does is really educate patients on their disease process and how to manage it better to keep them healthier, to keep them at home out of the hospital. So when I was growing up, I wanted to be a teacher. I had a family member who was a nurse. I thought, I'm not going to be a nurse. I don't want to be a nurse. All the little girls in my neighborhood wanted to be a nurse. I was going to be a teacher. And home health nursing really allows you to teach and also be a nurse. So it just worked out perfectly for me. I got to
Sounds
do
like
both
it.
of my passions.
That's wonderful. Not many people can say that in life. So that sounds wonderful. Is there such thing as a typical day for you?
Now, there's different things. So when I was a home health nurse in the field, a typical day was calling your patients in the morning, setting up your appointments, triaging which patients needed to be first, and then, of course, which route would be the fastest way to go so that you weren't backtracking. Sometimes you have to draw blood, sometimes you have to do IVs, things like that. So you generally made your phone calls, then you went out and made your visits. And then the end of the day was basically spent on charting and kind of preparing for the next day and updating what you had done that day.
Now, some people work in an office, some people work in hospitals or clinics, and you actually get to go and work in your patient's home. What is that atmosphere like?
It really depends on the home. I've been in every kind of home, to beautiful mansions right on the Gulf, to places in Miami that you had to watch where you walked because there were holes in the floor, and you had to go on Sunday morning while everybody was in church and before the bad crew in the neighborhood woke up. So it's really very diverse. And I think that's what I really loved about it, is every day was never the same day, and got to meet a lot of interesting people. So it could be wonderful, and not going to lie, it could be awful. There could be bugs. Many a time I had my backpack that I used as my bag. I kept it on my back. I didn't want to put it down because there were bugs or, whatever, and not try to hurt anybody's feelings, and just say, no, it's easier for me to reach this way. But I don't know. The joys of it, I would never again do any other type of nursing but home health nursing. The time you get to spend with your patients, the amount of one-on-one, I just don't feel you get anymore in a hospital setting. And I did hospital nursing for 12 years and I loved it. And it was a great background, but I really liked the one-on-one of spending time with the patient and the family. And
Now, for
you
students
just,
watching, I'm sorry, go ahead.
no, 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 go ahead. I tend to talk a lot, so cut me off.
That's quite all right. Quite all right. We're here to hear from you, not from me. Now, for students who may not understand, why do you have to go to their patients' homes? Why can't they just go to a hospital or clinic?
Well, first of all, sometimes they're too debilitated to go. And second of all, if we want to talk realistically, the cost of healthcare is much less in someone's home. So, and people are more comfortable in their home. They tend to do better if you ask, they want to be at home, so that we can facilitate that, I think is absolutely amazing. They learn better, they heal better. So, for a multitude of reasons, that's why we go to their home. Depending on the payer source, sometimes it has to be difficult for them to leave their home. Otherwise, Medicare or insurances would say, go to a clinic or to the hospital to get those services.
Right. There have to be extenuating circumstances, or heck, everybody would want you to come to their house and take
Right?
care of them.
Exactly.
Now, we have talked in the past for some career interviews about how, no healthcare provider is an island. You have to work within a team. So what fellow healthcare professionals do you work with?
So we work with, first off, the physician. We're kind of the eyes and ears of the physician in the home. Second, home health services also includes a physical therapist, occupational therapist, speech therapist, sometimes a dietitian, occasionally a respiratory therapist. So it's whatever services the person may need in their home, individualized to their diagnosis and their needs. But most of the time, it's the therapies, PT, OT, and speech.
Okay. And now, when we talk about your patients may be debilitated, which is why they can't make it to a hospital, but what kind of patients do you work with? Elderly, young? Give me a range.
So over my career, I've actually worked with every age group. When I was with a hospital-based home health, I actually did Billy lights on a baby in their home, which wouldn't, teaching parents so the baby doesn't have to go to the hospital and be put under Billy lights. I've given IV antibiotics to young children who stepped on, a piece of wood that they got infected and they needed IV antibiotics, and we did it at their home. The majority, though, are the over 65 population or people who are disabled of any adult age.
Okay. All right. That makes sense. Now, do you have a typical work week in terms of hours, like a 40-hour a week? And how does it affect your personal life having to be on the road traveling around?
So most home health jobs are 40 hours a week. It's kind of flexible though, because sometimes you can't get your patients during the day. You may have to make the calls in the evening. or you may do your charting in the evening. You kind of work it around what works for you. But traditionally, it's like 8 to 5. But I pretty much am available. And also, when I was a field nurse and I had two little children, I kind of worked around their schedule, dropped them off at school, and then went and did my day, picked them up from school. They came with me while I did my paperwork and they did their homework. So I feel like for a working person, home health care sometimes is a lot better for your family life. But I did have to make a lot of phone calls and a lot of planning in the evenings and weekends. If a patient calls me on the weekend, I certainly took their phone calls. So it can be a little stressful, so to speak, but nothing ever kept me from going to a school. If they got an award ceremony at 11 o'clock on a school day, I just worked my patients around it. So there is more flexibility than being in a hospital or a doctor's office, where you have to be there from 9 to 5.
That's good to know, and I'm glad that you're sharing, because I always like the students to know about the blood, sweat, the tears, and the joys of each of these careers. So thank you for being so honest and for sharing. And there are many different educational stepping stones within nursing, whether you start out as a patient care technician, maybe move up to a practical nurse, move up to a registered nurse, or Bachelor of Science in Nursing, master's degree in nursing, even a doctorate in nursing. With you, can you describe your educational career track?
Well, first, I'm old. I'm 66 years old. So back in the olden days, you didn't really require a lot more than an associate's degree, which is actually what I have. And back in those days, so that that only cost me $1,200 for 2 years of nursing school. Would I recommend that now? Absolutely not. There's so much more technical things that go on. I had 12 years of hospital nursing before I switched to home health. I don't know that someone needs that, but you definitely need to have good assessment skills, because when you're in someone's home, you have to be pretty quick at assessing if they're okay. Do you need to call 911? What measures you have to take. So I would definitely recommend at least a year of acute care, like hospital nursing, so that you kind of get those skills down and you feel a little bit comfortable in what you do, because you can walk into some, kind of tricky situations. And sometimes it takes 12 minutes for EMS to arrive on the scene. So you want to feel really comfortable that, you have a good fund of knowledge. And I would recommend as much education as you can get that you can afford is always wonderful. But you can be a home health nurse as an LPN, which you can go to a 2-year program. I actually did that in high school. So I felt pretty good in going into my nursing career because I had 2 years of LPN in high school, and then I just had 2 years of an associate's degree. All I could afford back in the 70s, and really all that was required.
And students, you should check with your counselors at school, because you may have the ability to do dual enrollment at one of the local technical colleges where you can get in on the ground floor of nursing and therefore get a job straight out of high school and then continue your nursing
Right.
education. So good advice.
And most places pay for, furthering your education. So it's really a wonderful thing. I was never the best student and I really needed to be able to support myself. So I didn't push for more education, but my daughter has a BSN and it's really taken her far. And I really feel like in today's world, you do need a little bit more. But LPNs, very well thought of in home health, 2-year degree. It's really all about you as a person. And are you flexible? Are you confident? And do you have good assessment skills? And sometimes those come on the job training more than anything else, being able to pick up that there's a problem. So don't ever let it, that you can't do home health because you don't, or nursing at all because you don't have a bachelor's degree, because there's room for everybody.
And we always recommend further education because education is something that nobody can take away from you once you have it. And you can always build upon what certification or what degree you have. Your education will never go to waste. That's for sure.
Yep. And for me, every time they offer, do you want to be an Alzheimer's educator? We'll send you. Sure. Do you want to learn a a what is it? ALS, advanced life saving? Sure. I took advantage of everything that they offered me to enhance what I already knew. But all I could say is I never wanted to be a nurse. And it's the best decision. I think I'm going on about 46 years. And it's the best decision I ever made in my life. You can support your family on even an LPN salary. And I just find it so rewarding. And all the different things you can do now with nursing. You know, you don't have to be a hospital nurse. You don't have to be in a doctor's office. There's so many opportunities that a lot of other degrees don't allow you to have. You know, if you're an accountant, you're an accountant. But if you're a nurse, you could be out in the community. You could, the sky kind of is the limit. You could be a travel nurse. You can be an educator. For the cost of the education, in my opinion, there's really nothing better.
Agreed. And so many different specialties you can go into, and you don't even have to stick with one specialty. You can rotate through the different floors of the hospital, the different specialties in there. So it can really keep it interesting for you
Very,
throughout your entire career.
yeah, very. And that's how you learn more things. You learn what you like, what you don't like. On the job training is really so important. But it's been amazing for me, for someone who up until high school, and basically my mother said, well, this is free, so you're going to go to LPN school. And I'm like, okay, but that's not what I want to do with my life. And then I got into college and I was like, well, that's not what I want to do with my life. And then it was when I got my first job, I was like, wow, this is what I want to do with my life. So it's just been amazing.
Sometimes it's good when parents push because you know
Yes.
what? Sometimes they do know better. How about that?
Yep.
All right. What is the least satisfying about your career?
Having to deal with insurance and limitations that insurance puts on it, or non-compliant patients that no matter what you try, they, I always wonder, is it compliance or education? Is it will or skill? And when it's will that they don't want to do, that's very frustrating because no matter what you put to them, they don't want to do it. But if it's skill that they haven't learned it and you can teach it to them, whether it's about their diet, quitting smoking, um, that's the good part. But otherwise, when willful patients, I think that's the most difficult. And frankly, although I can't even really say this because I've actually watched and helped a lot of families get through death, that might be scary to some people, but it can actually be very rewarding and you can really feel like you make a difference because that may be turning people off to, I don't want to be a nurse. I have to see bad things. But helping people through bad things sometimes is extremely rewarding.
So that segues into my next question is what's the most satisfying?
Seeing a patient be successful. I helped a gentleman with heart failure. The doctor told him he was going to basically be dead in 3 weeks. And basically, through the education of, how he managed his CHF, he actually lived for 6 months. And for most of the time, it was a pretty okay life. The best was the day that he actually went out to dinner with his wife to their favorite restaurant. So teaching him how to manage his heart failure so that he could, have some quality of life. That was probably my best favorite thing.
And now I was going to ask some more questions regarding your actual patients because, you've been on the job for a long time. I'm sure you have a lot of patient stories. Would you like to share another patient story that really stuck with you all these years?
Let me see. I had a patient that had had open heart surgery, and nobody ever told him not to go swimming in the Gulf. So his right after surgery, he went swimming in the Gulf and got a really nasty infection in his chest wound. And through when I went to his house, it wasn't exactly super clean, which probably didn't help for the infection. But we actually got him through the infection. Took a long time, took about, I don't know, 10 weeks. And the infection was healed. And actually, this was, well, it was when John Kennedy Jr. died. So that's quite a number of years ago, right? I feel like he might actually still be even around and living. So every so often I would get a text or an email from his family members. But the doctors really thought it was never going to heal. So that's very rewarding when you can work as a team with the doctor. The therapy got him stronger, and the education to how to keep it clean really made a difference.
I can only imagine the frustration on your part. When
Yes.
you how can you not know when you have an open wound you should not be going to the beach, you shouldn't be swimming out there. There's so many things that can happen to you.
Well, I think people think salt water is good for wounds. And maybe like 30 years ago, before the water was a little polluted, maybe that was good, but sure not so much now.
No more, no more. Well, we're getting ready to wrap up. For the students watching who are thinking, you know what, I'm definitely interested in nursing and home health sounds just flexible enough to be the right path for me. What would be your best piece of advice for students interested in taking the home health nursing career path?
I would tell them get their education, get a year in acute care so that you kind of are familiar with wound vacs and IVs and you see patients in real life situations. So if you walk in on one, you know what to do. And sometimes people will let you shadow as with a home health nurse when you're in your career, when you're in school, to just kind of see if that is something you want to do. But I think the best advice is nothing is forever. If it's not good for you, you try it. If it's not good for you, there's thousands of other jobs. Nurses are in great demand. It worked for me. I had little children. My husband passed away when they were young, so I really needed to be flexible. So for me, it worked out really great. They could come with me at the end of the day, and as long as they were quiet, to do their homework. Matter of fact, a bunch of the nurses that I worked with, all the kids would sit together and do their homework while we did our end of the day work. That's not something you can really do in a hospital or a doctor's office. So you just have to find what works for you and your family. But for me, the most rewarding kind of nursing that I ever did. Obviously, why I've done it since the about 1988.
When we talk to other healthcare providers on here, the path to a career is rarely a straight line. It's always a winding road. You're sampling, you're trying things. And I know over the years that you have morphed your nursing career many different ways. What are you doing now?
Now I'm what because I am older, so I don't go into the homes anymore. I do care coordination and community, like a community liaison. So care coordination would be if a person is in the hospital and the doctor says, "Hey, I think they need home health," I arrange the services. So I would say, looks like they need a PT, a speech therapist. These are the things that they need in the home, and I make all of those arrangements with my company. Talk to the family, explain how it's going to go, and kind of get their buy-in to this is what we do, this is how it's done. I think I love that part because I love for families to know they can bring their loved ones home if it's a safe environment. I really love the community liaison part of my job. Right now, I'm very involved in dementia care and cure, and I do a lot of fall prevention educations. But basically, I can go anywhere and kind of do any type of health education that either an assisted living or a mobile home park might want. So for that part, I really love, and I work with the health department, with EMS, with the trauma center at the local hospital, work out with the Alzheimer's Association. So I've been able to do so many different things that it's kind of really, both aspects of my job now are great.
Thank you for being a nurse. Thank you for all of the good you do for our community and for our community members, your patients. We sure do appreciate you, Lisa, and we appreciate you coming on today for this career chat so students can know yet another opportunity within the nursing field.
Well, if they ever need to know what it's like, they can look me up. You can give them my contact information. And I would tell you, even if home health nursing is not for you, nursing is a wonderful career. It has served me well, supported 2 children by myself pretty nicely. They're both college educated. And I know when you're in middle school and high school, you're not necessarily thinking along those lines. But I've had a lot of excitement working in the ER and ICU in the hospital. So I can't think of any career that's really better.
That is good advice, Lisa. And when you're out there, students, and you're trying to figure out what the heck do I want to do when I get older, what education path, what career path, remember, that's what we're here for, our Reach student programs, Gulf Coast South AHEC. We have all of these free student programs. Contact me via email. I can put you in touch with Lisa. Contact me by a phone. I can tell you more about our Reach student programs. We are here for you. Thank you so much, Lisa, for giving us your time today. Have a wonderful day.
You too. And thank you so much. Go nurses.